Well, there's one item under F, which is appointment of ministers, committees and panels. There's a nomination for a member of the Planning Committee, and I ask the Chair to make that nomination.
Thank you, sir. I would like to nominate the Constable of St Clement as the final member of the Planning Committee.
Is that nomination seconded?
Yes, sir.
Yes.
And are there any other nominations? If there are no other nominations, then I declare that the Constable of St Clement is appointed to the Planning Committee. There are no matters under G and H, and of course, written answers to questions have been lodged under I. And we come now to oral questions, and I invite Deputy Ward to put his question to the Minister for Housing and Communities. Deputy.
Thank you, sir. Just get used to this usual mechanism. So may I ask the Minister, will the Minister advise how many people, to the best of his knowledge, are currently classed as homeless and without temporary accommodation, and what action is being taken to find these people suitable accommodation urgently?
Minister.
Thank you, sir. I assume the Deputy is referring to those who are roofless or sleeping rough. Those figures are in single figures, low single figures, meaning that they are readily identifiable. So I'll talk in general terms. As it stands at the moment, we currently do have capacity in the refuge. If somebody presents with emergency housing issues, they will not be turned away without the offer of accommodation. Unfortunately, for a small number of people, the simple offer of accommodation is not for them. It's not enough for various reasons, which we must respect, various circumstances. But all of those that are sleeping rough, we are in touch with. The critical support team, the occupational support team know the whereabouts of them all, are in constant contact with them, are organising with agencies, consultations, including with GPs. And the aim with all our homeless, those who are in temporary accommodation with a roof over their head in the refuges or in the sanctuary trust or where have you, what we are aiming to do is put them on a pathway out of homelessness.
Supplemental, Deputy?
Yeah, thank you, sir. Sorry, there's a bit of a problem with microphones at the moment. So I was referring as much as anything to those hidden homeless who could very quickly become without a roof over their head. But I would ask the Minister to make a commitment here and now to ensure that people this winter will not be left homeless or sleeping in vehicles, for example, sleeping in their van, sleeping in their car. And there are many hidden homeless on this island, sofa surfing, for example. Can I ask the Minister to ensure that on a wealthy island such as Jersey, we will not leave people in this situation of homelessness this winter?
Yes, the Deputy is right. Those who are sofa surfing are classified as homeless. It's not appropriate. And whilst it might sound like a good idea at the time, we encourage people not to embark on that. Also, those who are living in unsafe accommodation, possibly in a dangerous situation with whom they are living, they are classified as homeless too. And we do our best to identify everybody. We now have the Housing Advice Service, which is busy, and people are approaching it. And with that, it's been operational since July the 22nd. We're able to collect data on the trends of who is seeking help. But I just want to reiterate that we do have capacity at the moment in the shelter and at the refuges. We are increasing capacity with the money the government has provided to Shelter Trust. There's a new women's only refuge coming online this year. That's with 20 beds. That frees up 20 beds elsewhere. We're also going to, with the help of Andium Homes, move the women's refuge to new premises, double its size. So there is increasing capacity. But yes, everybody who presents to us with emergency housing issues will be found accommodation. If the shelter is full, we have other ways and means with some very helpful landlords.
Senator Mezek.
Thank you, sir. When I've attempted to help a constituent recently who I was put in touch with, who is currently sleeping in their vehicle and is on band 1 of the housing gateway, when I got in touch with Gateway, I appeared to discover that there's such high demand for band 1 one-bedroom properties right now that urgent cases are not even being able to be presented with a timeline for when those people will be housed. Can the Minister confirm what attention he and his team are giving to those urgent cases to make sure that nobody in this very affluent island is sleeping in their vehicles with no idea for when they will one day get a roof put above their head?
Well, I do know of 2 instances currently with people sleeping in their vehicles. Those people will have been offered accommodation in one of our facilities. But as I say, sometimes these issues are highly complex, of course, always very individual, and we keep a tight hold of those that we know are sleeping rough, are roofless, and the critical support team is in constant contact with them.
Supplementary, Senator?
Yes, sir. Can I ask the Minister that as winter approaches, if there are cases where they're unable to provide accommodation for, even if it's purely on a temporary basis, would he be prepared to ask the Treasury Minister to make financial assistance available to ensure that people have a roof above their head throughout winter? And further to that, would he be prepared to use his ministerial discretion in those instances where temporary accommodation is provided to those people, that it does not disrupt their position on the housing gateway so that they don't become a lower priority for receiving permanent accommodation? Can you very specifically give me those guarantees?
Yes, I'm happy to do that. And can I just say that in the wintertime, more potential beds become available to us in some B&Bs and some hotels. And so we have actually in the winter greater availability, and we're in touch with a lot of those landlords, and I pay tribute to them because they are extremely helpful for us.
Well, Deputy Tadier.
Thanks, sir. I have a question about a very specific type of homelessness, and the Minister might know that there was a fire very recently following a lightning strike in St Brelard where a number of homes around the Portlet area were affected. Has the Minister been, or his department, anyone from his department, been in contact with those individuals? And when this kind of thing happens, does he think it's appropriate for his department to be in contact with those to see what help can be given?
I don't want to talk about individual cases in this forum. I have a feeling that we have been in touch, and my officers have been helping in that instance. I will check on that and get back to the Deputy. I know that this is a concern of his, and he's absolutely right. We must try to ensure that this doesn't happen again, and that one party or the other is insured against such a thing happening and people being made instantly homeless.
Well, Deputy Southern, I'm not calling upon you yet, but did you want to ask a question?
I did, sir, but I don't have the correct equipment with me today.
Righto. Well, in which case, if you could ask through a colleague in future, and I will certainly call you for this question. But no, I mean, I realise you have, but I just wanted to make sure what the position was.
And just to clarify, so I don't need a supplementary. I'm happy to give the time to someone else.
Thank you very much, Deputy Tadier. I have Deputy Doublé, then Deputy Southern.
Thank you, sir. I wanted to ask the Minister about another category that he mentioned of those who are in temporary accommodation, because I'm certainly aware of a number of families who are affected by our housing crisis, for example, that have one family in a bedroom, perhaps at their parents' house while they're waiting for homes to come up for sale. And so is the Minister aware of the scale of this issue? Does he have any figures on that, please?
Well, as part of the homelessness strategy, which was published earlier this year, we've partnered up with Homeless Link, UK Homeless Link, to benefit from their experience. They've been doing extensive workshops and consultations with everyone in the industry, everyone who is charities, agencies, we're all trying to assist with the homelessness issue. And their report and recommendations are going to be with us very, very soon. They've also been collecting, I believe, the sort of data that the Deputy is talking about. I think the next piece, so I await their recommendations. I think the Deputy might be interested to know that we are talking about, it's in its infancy, but I think the next big piece of work we're going to do in relation to this sort of thing is especially to target vulnerable women, long-term vulnerable women, trying to finally find a solution for their issues, and trying to nip it in the bud with short-term or vulnerabilities that have sprung up in the short term for some women. So that is being formed now. We have seed sponsorship interest from private sector, and then government would then have to take that forward. But that is probably coming down the track, I think, next year.
Supplementary, please.
Yes, indeed.
The Minister mentioned vulnerable women and funding from the private sector. Will there be any change to the funding currently supplied to the Women's Refuge, please?
Well, as I say, the Women's Refuge is going to double in size. It's going to move premises. Andham Homes are taking care of this. So that is good news. There might be, obviously, if it's twice as big, it might cost more to run. We'll have to facilitate that, of course.
We'll have Deputy Southern, then final supplementary. Deputy Southern.
Thank you, sir. Could the Minister inform members what timescale he has for the new beds coming online? He's mentioned sometime next year, but could he be more specific, please? When are we going to see these new beds to meet demand?
Yes, the new women's only shelter, 20 beds, will come online this year, and the moving of the refuge, the Women's Refuge, will take place in 2022. So we get two bites of the cherry with a new women's only shelter, because that releases capacity elsewhere.
Supplemental, Deputy Southern. Final supplementary, Deputy Ward.
Thank you, sir, and I thank the Minister for his commitment to ensure that nobody is left homeless this winter. But can I ask him to just clarify that extends to the age groups that are below the age of social security, i.e. below 25, in particular those people, young people who are care leavers, who can easily slip through the net. There's so many questions, and those who perhaps may be evicted due to rent arrears caused by COVID, because I believe that law is now being ended, that protection is being ended. Can he commit to extend it to those people as well?
Yes, it is. It's universal. The critical support team, the housing advice service, is for everybody. And the sooner people can identify issues that might be coming down the line, get in touch. My advice is get in touch with the housing advisory service so that we can try and get the problem sorted so that that person doesn't become homeless. And can I repeat, because I'm afraid the last night's Evening Post was full of factual errors, and there's confusion between what is the Sanctuary Trust, a charity, a long-term focus, with what is the shelter, with what is the refuge, and other charities. If people present in an emergency to us at shelter, we will find them accommodation. We will find them a roof over their head.
Well, we come to question 2. The Connétable St Martin will ask for the Minister of Social Security. Connétable.
Sir, will the Minister explain why current health and safety rules prevent fresh supermarket produce, some just one day past its sell-by date, from being donated at food banks, even to a person who has signed a disclaimer to acknowledge the food must be consumed immediately or frozen? And will he take action to amend this guidance to ensure food is not wasted and that those involved with food banks are not negatively impacted?
Minister.
So I think the greffier has redirected the question to myself as Minister.
It doesn't say so on the order paper, and I didn't realise that. Sorry. Yes, in which case, yes, Minister.
Under the food law, there are 3 types of standard labelling used on food products: used by, best before end, and at the discretion of the seller, display until dates, and they all have rather different meanings. At the moment, the Environmental and Consumer Protection team provide guidance and support to several charitable services to ensure that the food they provide to consumers is safe to eat. And there are several charities that already freeze produce on the final day of the use by date for meals, and these organisations already comply with the food legislation to protect the consumer, and I understand that system works well. Food banks are a little more complicated in that the control of the food products and any risk associated with it, of course, move on to the consumer. So restrictions, regardless, the restrictions remain the same, so not to put service users at risk compared to those of other charitable services who facilitate this provision. And of course, we are producing a new food law, which is necessary under the new the post-Brexit situation, and that will assist supermarkets in providing that food is safe to eat, to providing that food to charitable organisations and maintaining the public service. So that's the situation.
Supplemental, Cointop?
Because of this ruling and overzealousness, we've had to close our much needed food bank. Could the Minister also explain why the food which is being denied to the vulnerable and those in need in the parish is then deemed to be okay for the government to collect to feed COVID workers with the same food? This is happening, and much to our alarm happened on Friday, the day we had no option but to close the food bank.
Well, so I don't know of this. I'd be happy to take that, to have that investigated further, this particular incident, sir. I think food banks are in a different situation to charities. I think what the answer I've given concerns basically produce that is taken off shelf by supermarkets. The use by date is about product safety, and that's the most important date because it accepted under all food standards that there is a risk of some food poisoning if products are consumed beyond that date, but there's no reason why it can't be cooked at that time or frozen at that time. And indeed, my understanding is that the charities have freezers full of this material. So I will arrange to have this particular incident situation investigated in more detail. I'm sorry, I can't go further than that at the moment.
Deputy Ward.
I think so. I'm having trouble hearing the answer here. This question may just have been answered, but if it is, can the Minister confirm whether food that was usually taken by the food bank was redirected to any form of government worker, and therefore did the rules that stopped it going to the food bank no longer apply because it was going to government staff? That's, I think, a very important question that we need to know, because there's an inconsistency there, and most of all, we want a consistency, please, sir.
Minister.
Yes, I think I'm sorry that the Deputy didn't hear. I try and speak a bit louder. Yes, I will have to investigate that. It is of concern that food that is intended to go to food banks appears to, has been suggested, has got into the hands of other people, if you like, that are not in need of the food bank. So I need to investigate that and find out why. So I'm sorry, I can't go further than that now, but I give a commitment that I will arrange for that to be checked and reported back.
Supplemental, Deputy.
Thank you, sir. Can I ask the Minister, seeing as I don't mean to make a prediction, but we may be here a few days this week, that he could come back with the answer during this sitting, because the next sitting is actually not for a month due to the 3-week sitting and a half term, and this answer will be lost in the ether. Thank you, sir.
Yes, I'm happy to give that commitment. I discussed this. Obviously, this is not within my mainstream experience. I spoke with the environmental health officers who do this work yesterday. They didn't give me any information that along the lines of what appears to have happened here, but I will find out from them and get it investigated and get back during this sitting. So I will give that commitment.
Deputy Talia.
So, as part of a minister who's on a council of ministers who's committed to reducing income inequality, could he state whether he feels uncomfortable about how many people rely on food banks in the first place in Jersey, and that we're discussing today about ways to give poor people who can't afford food almost out of date food to eat and access it in a very wealthy island? Does that concern the Minister?
Well, I think there are two issues. Certainly, I'm very, very uncomfortable with the situation that such should occur in Jersey, that people are having to rely on food banks. I think that's when we are an incredibly wealthy society and people buy properties for 31 million, and it's absolutely, I think, almost obscene. Frankly, that's the case. But obviously those responsibilities don't lie with me. My role is regulatory. And of course, that's why we have food standards. And I think the question is that this whole question of the use by dates, those dates are there for a reason under law, because we rely on our really high quality food. And obviously our retailers ensure that what we buy in the shops is of the quality required. But there's no reason why, as long as that material is taken off shelves and goes to charities for use by those in need, and it's either cooked at the time or frozen, there's no reason why that shouldn't happen. In fact, there's every reason why it shouldn't be happening, rather than it go into the incinerator, which is incredibly wasteful.
Supplemental, Deputy Taddy?
Yes, and I do ask the question in the context that the Minister is the Minister also for Environmental Health. And I'd like to know if he would prefer a situation where people didn't need to rely on out-of-date food because they're so poor and there isn't provision for them in this island, rather than trying to find ways to allow them to eat out-of-date food.
Well, I think, look, two things. Of course, I'm very embarrassed that people have, to, in a situation where their circumstances so they have to rely on it. But I have to say that the food is safe. So, the Deputy talks about out-of-date food I described. There are different dates, they mean different things. The use by date is the important one. And as long as it's used by or frozen at that time, it is perfectly safe. And that is the basis of the food law.
Well, I have Deputy Morell and then the Conitab for final supplementary. Deputy Morell.
Thank you, sir. Would the Minister explain whether his department gives guidance to food banks and people who operate food banks so they understand this classification system and that to make sure they're not confusing best before end with use by?
I think at the moment I can't confirm how effective that advice is. Yesterday, in my discussions with the officers, I've been told about the charities that either receive the food and cook it straight away for consumption, because that's another immediate way of dealing with it, cooking at the time that the material leaves the shelves, or freezing it. But whether or not, how we got into the detail of food banks, and I'll be frank, I don't know, and I admit my hands up here, I don't know how many food banks there are on the island, and that is the thing I should be checking up on, as I've agreed to do.
Very well. Supplemental, Deputy Morell.
I think.
Final supplementary, Conitab St Martin.
Thank you. Thank the Minister for his answers, and just would like to say that the various shelters are suffering from these health and safety rules too. So please can the Minister reiterate and ensure that the food can go to those in need and not be used for government workers, or worst of all, be dumped. Thank you.
Minister?
So I can't do any more than reiterate the commitments I've already given. I think there's a lot of really good sound questions here that I will make sure investigated and have a supplementary answer sent round to members, and as soon as I can, but certainly during this session, sir. Thank you.
Very much. We come to question 3. The Deputy IA will ask of the Minister for Infrastructure. Deputy IA.
Thank you, sir. Given that the St Helier Roads Committee has now passed the Phase 2 speed limit review, how will the Minister analyse the effects of these changes on traffic flow and congestion prior to making any decision on whether to implement the changes permanently? Thank you.
Minister.
Thank you, sir. As Minister for Infrastructure, I am responsible for setting speed limits and do this within a published policy framework agreed with the parishes. The framework considers the characteristics of Jersey roads to set appropriate and consistent island-wide speed limits that balances users' varying needs. The framework provides for a review process to be undertaken in partnership with parishes to ensure that local context is properly considered and community opinion is gauged. Prior to any recommendation being presented for my consideration, the parish's proposals are subject to a technical review against policy framework by my department's road safety engineers, who, working with the parish, seek to resolve any inconsistencies in the proposals. No decision to amend speed limits will be made until that process has been complete. Thank you, sir.
Supplemental, Deputy.
Thank you, sir. Will the Minister ensure that he reads all of the consultation documents brought by the parish of St Helier on the 22nd of September, and before he makes his decision, and that he considers each road separately rather than authorising all these radical changes en bloc, as have the Roads Committee? Thank you, sir.
Indeed, sir, I can make that commitment. My team are very technically minded, and they will go through every single road individually prior to a decision being made, sir.
Well, Colin Halverson-Wong.
Thank you, sir. My question for the deputy is: will he consider the opinions voiced in the surveys undertaken by the parish of St Helier, which, on the face of it, seem to have been ignored in their final decision when he makes his decision about which roads to change the speed limits on? I note from his comment that he said community opinion will be gauged. Could you just give us an assurance that that will be the case?
Absolutely, sir. It will all be taken in the round. So my team do a lot of research on each road individually, and there will be consultation with the local community regarding the appropriateness of any speed limits.
Supplementary, Colin Halverson-Wong? No?
Yes, sir. Sorry, I'm just having trouble switching my mic on. Yeah, just a further assurance that the appropriateness of the speed limit in relation to the roads to which they'll be applied to will also be given serious consideration before any final decision is made.
Absolutely, sir.
Colin Talbot-Greville.
Thank you, sir. Thank you, sir. Does the Minister not think that the parish of St Helier should hold a parish assembly to ratify the decision of the St Helier Roads Committee before he makes the decision to implement the changes?
I was of the opinion, sir, that it was all discussed at a parish meeting to discuss the various St Helier Roads Committee recommendations, sir. But absolutely, the parishioners should be turn up at the parish hall and, if necessary, take a vote on each individual road, if that was their wish, sir.
Supplemental, Colin.
Yes, sir. Does the Minister think that he should listen to parish assemblies in all parishes if they propose speed limit changes?
Absolutely, sir. I'm committed to consulting with all constables and all roads committees of all the parishes on the island, sir.
Constable St Helier.
Thank you, sir. Does the Minister agree with me that 20 is plenty in residential areas of the built-up zone, and that residents of St Helier's densely populated roads have the same right to the heightened road safety protection as islanders living in, for example, St Peter's Village or St Mary's or St Aubin?
As previously stated, sir, the Technical Safety Committee and Infrastructure will go through every single road to determine that, sir. And if that is appropriate, then that will be adopted, sir.
So can I ask the Minister to answer my first question before I pose a supplementary?
I can't do a blanket agreement on the whole of St Helier for 20 miles an hour, sir. As I say, every road will be taken on its merit, sir.
So if I could restate the question for the Minister's benefit, I asked him, does he agree that 20 is plenty in residential areas of the built-up zone, as is already being done in many parishes?
And I will repeat, sir, every road will be taken on its merit. If 20 is appropriate, then 20 it will be.
Can I ask my supplementary now, please, sir?
Well, now I think, Contab, you've the answer given by the Minister is the answer he's given in the last 3 iterations, and I think that must be treated as a supplementary.
So that didn't allow me to ask my supplementary because he was failing to answer my original question.
I think he answered in the same way. But I think in the exercise of my discretion, I will allow a supplementary question in this regard, as we're well within time for this question.
Thank you, sir. Could the Minister confirm that the Roads Committee of the parish is the highway authority in each case and not the parish assembly?
Indeed, sir, but obviously, it's, as the constable is aware, it's crucial to have the opinion of the residents of the various parishes on board, sir.
Final supplementary, Deputy Ayub.
Thank you, sir. Of the 674 submissions received by the parish of St Helier, 63% of them did not support the speed limit changes. Will the Minister be backing the majority of islanders who have made their opinions clear? Thank you, sir.
I think, as I've previously alluded to, sir, every road will be taken on its merits. I cannot predetermine any speed limit of any particular area, sir, but every reduction or even increase must be fully justified, and my officers will go through every single road meticulously, sir.
Very well. And we come to question 4 that Senator Ferguson will ask of the Minister of Health and Social Services. Senator Ferguson.
Thank you, sir. Will the Minister advise whether there have been any delays in response time and provision of information by the Health and Community Services Department to subject access requests? And if so, will he explain the cause of such delays?
Thank you, sir. I'll call subject access requests SARS. As of the 1st of October this year, 241 SARS have been received by the Health and Community Services Department during 2021. Of these 241, 10, that is just over 4%, were or will be disclosed outside of the 84-day time frame allowable within the relevant legislation. Of those 10 SARS that were or will be disclosed outside of the time frame, 7 have already been disclosed and 3 are waiting on harm checks prior to their disclosure. The SARS that were or will be disclosed outside of the time frame are either children's services or mental health records, and as such are often significant in volume or require redaction prior to disclosure to reduce the impact on the privacy of third parties, and or they require harm checks. Some medical record requests are also voluminous and may be in clinical use when requested. Clinical use has to take priority, and this can cause delays to the processing of the request. Thank you, sir.
Supplemental, Senator Ferguson.
Thank you, sir. Is the Minister not aware that HCS actually has an appalling record in replying to subject access requests, Dr. Al Witry being a prime example? Does he not think that as Minister he should actually investigate properly the reasons for this?
Sir, I don't agree it is an appalling record. As I've said, 4% of those were unfortunately disclosed or are being disclosed outside of the time frame allowed by the legislation. So that's not appalling. And furthermore, I have ensured that there are very good reasons, which I have explained, that they are disclosed outside of that time frame. That is significance in volume, they require redaction to reduce impact on the privacy of third parties, or they require harm checks because some people who are seeking these records are in themselves very vulnerable, and we have a duty of care towards them. Thank you, sir.
Conor St Lawrence. Conor St Lawrence. Deputy Morell.
Thank you, sir. Sir, the Minister mentioned 84 days, which appears to be approximately 3 months, which seems a large amount of time to respond to subject access requests. Does the Minister believe that a lack of digitalisation of records, not just medical records, but also other records in the Health Department is contributing to the delays, whether it's just in the 4% he mentions, but also overall taking 3 months in order to respond?
Yes, sir, that is very much the case, that heavy, bulky paper records which have to be trawled through do just build in delays. When we move to digital records, I'm sure the accessing of those records will be easier. But Far and away, the majority of these SARs are responded to at an early date. The difficulties arise only in the minority of cases for reasons that I've stated. Thank you, sir.
Supplemental, yes.
Yes, please, sir. The Minister mentioned when we do move, would he enlighten the Assembly as to when will the Department move to digital records?
Yes, I can, sir. That's really the part of notes I had on the Deputy's own question later. So paper records are going to be scanned into a dedicated platform. And this is called the electronic patient record, within which there's an electronic data management system. The outlined business case is complete and approved. A full business case needs to be drafted, but first a procurement exercise must be completed. The procurement will be completed before the end of this year, and we expect the full business case to be completed in Q1 of next year. And then it will take 18 months to scan all the hospital records, I'm advised. I hope that helps, sir.
Very much. Deputy Higgins.
Thank you, sir. The Minister said only 4% weren't answered within 84 days. Will the Minister tell members what the actual normal date is for a subject access request to be answered? It is considerably less than 84 days. Will he please tell members?
I don't have a figure that has worked through and produced a mean, sir, but the fact is that 96% of them are answered within the time frame allowable within the relevant legislation. And I'm sure that very many of them, the majority of them, perhaps being the simpler requests, are answered at a very much earlier stage.
Supplementary, sir.
Yes, Deputy.
If my memory serves me correct, and it may be wrong, but it's certainly lower, it's 40 days or less for a data protection answer to be given. Your department, Minister, is one of the worst on the island for doing it. And many people who have been taking, wish to take action against the hospital, let's say for medical negligence, have been denied records even after 84 days. What do you answer to that?
So I'm sure the Deputy will be aware of the complexity of hospital records, which in the case of somebody who's lived locally for many decades in the island will date back perhaps 80, 90 years. And there'll be voluminous records, some of which might be relevant, some not. So this could well be the reason why it is difficult within HCS, and there is a difference with other departments. Sir, data protection legislation does provide for a time frame with extensions up to 84 days, after which it is permissible for applicants, if they've not received their records, then we are in breach of the legislation at that stage, and matters can be taken up with the Information Commissioner. And I know they regularly are, and we are in good contact with the Information Commissioner, who does challenge HCS and is aware of the difficulties. Thank you, sir.
Senator Moore.
Thank you, sir. And I last week received an answer to a SAR that I had put in on behalf of a constituent. It came in just under the 3-month overdue mark and didn't actually adequately answer the question. I mentioned that incidentally. So what I did notice in receiving that response, however inadequate it was that it uses an additional platform, one that I'd never seen before, called Egress, which meant that the person receiving the response has to log into it. So the question is, why, when we are supposed to be moving to a slimmed down, simple to use digital world, why has the department chosen to add an additional layer of complexity in providing information to members of the public? Has this slowed the process down somewhat?
So I'll happily take that up with the Senator. do I understand that the applicant was being asked to log on to a digital system for records, in which case I'm not aware of the detail of how that individual case may have been answered, but I undertake I will take it up with the Senator if she wishes to pass on details, sir.
Supplemental, Senator?
No, thank you, sir. I'm great.
No. Deputy Ward, and then final supplementary, Senator Ferguson.
Thank you, sir. May I ask the Minister, he talks about a time frame. How does he monitor whether there are simple cases are getting extended simply because his department can use that time frame? How does he monitor the effectiveness of responses? And does he see that digital records in the future would bring down that statutory time of 84 days maximum? And if so, will he be bringing that change to legislation once things are digitised?
So I know my staff take very great care over all applications, they are really exercised by the difficulties in ensuring that the more complex records are released safely and thoroughly and in time. The simpler records, I'm sure that they will attend to very quickly, as they can within a reasonable time, because they are simpler to do. There's no reason why they should be left outstanding. It is the few more complex ones that take up their time that create the difficulty. As to the change in legislation, that is possible. One will have to allow a bedding in period to see how this works. But if it is feasible to reduce, though I imagine this time frame set out in legislation governs not just HCS, but all government departments, indeed all island data protection issues. So it will be for the Minister of the time, and this probably doesn't come under HCS, but whoever has ministerial responsibility for data protection will need to keep this in mind and consider changes in the future. Thank you, sir.
Supplementary, sir?
Yes, Deputy.
So, the Minister mentioned that if the 84 days isn't reached, we can go to the Data Commissioner. But can I ask the Minister, what support is given to people to pursue the problems that they face? People who may be vulnerable, people may be, to put it simply, sir, fed up with the system that they're engaged with and may just give up. So what support is in place, and does he feel that that support to access the system is adequate?
Well, so we in the department support these applicants. This is not an antagonistic issue. This is a legal right that they're entitled to, and we provision that. So we will work with those. But in addition, we've heard from various members in this questioning that they are supporting various applicants. The Information Commissioner will also be on hand to assist citizens' advice. I'm sure there are various sources, but sir, I would urge anyone who feels they're having difficulty to reach out to all those various sources of help. Thank you, sir.
Final supplementary, Senator Ferguson.
Thank you, sir. I think the Minister is living in a different universe to me. The data protection rules say 1 month. Dr. Al Witry had to go to court. I've got another constituent who'd had to wait some years. Will the Minister provide the states with a list of subject access requests over the past 5 years, together with the time taken to reply and an identification of any rejected and the reasons why they've been rejected?
Minister?
Sir, I'm willing to discuss that with the Senator, but my immediate thoughts are with over 241 requests thus far in this year. So there may well be 300 each year. If I was to divert my staff into trawling through 5 years records, perhaps up to 2,000 records with that sort of data, when we know that 96% of this year's records were released within the time frame allowable? What value is that? So if the senator has specific problems, I'm willing to speak with her, but I think diverting staff from important work to produce that sort of data, would she please try and meet me, or we'll chat, to persuade me why that might be necessary. Thank you.
Perhaps the minister would like to use one of his myriad managers to look at
I'm
this.
sorry, and so that was a final supplementary, and the minister has answered it. So that does end this question. Question 5, Deputy Gardner will ask of the Assistant Chief Minister. Deputy.
Thank you, sir. Further to reports from the project team that in the development of the new hospital, digging into granite would cost 10,500 per square meter, and clinical and non-clinical space would cost 5,500 and 3,500 per square meter, respectively. Will the Assistant Chief Minister provide the total planned square meterage within the new hospital of each of these 3 categories?
Assistant Chief Minister.
Thank you, sir. I believe the Deputy may be referring to some remarks made during a recent scrutiny hearing. These remarks were examples of high-level comparisons to illustrate that some elements of the works are more expensive than others, sir. The works costs for the project have been informed by the cost plan, which has been provided to the scrutiny advisory team, and which explains line by line the build-up of the main works costs. The cost plan follows the industry standard guidance on construction cost plans and is split into element headings. So, for example, the substructure, the frame, the upper floors, the roof, the stairs, the ramps, external walls, and breaks the cost down for each of these. Given the stage of the project, this is I believe or the team believes there's a more detailed way of working out costs, and has been used to develop the cost, rather than just using an average cost for clinical and non-clinical space, because clinical space is not just one cost. There are lots of different layers of cost for clinical space, whether it's very high specialist cost, such as operating theatres or wards or clinical corridors, sir. However, information on all the areas is provided in the schedule of accommodation, sir. Thank you.
Supplemental then, Deputy Gardner.
I'm trying to digest, so I need a minute, that the cost that I stated was stated by Professor Hunter and it was published. So the question from my perspective, sir, wasn't answered, because it was a very simple question. And my supplementary, it's the costs that were mentioned for 3 categories, and the question how many of square meters were allocated in the hospital for each of category, or if it's not, why these 3 costs were mentioned.
So just to yes, I can answer that, and thank the Deputy for the clarification. But those were, as I said, a high level example of the fact that there were different costs for non-clinical and clinical. So the hospital project doesn't just break it down into those 2 categories or 3 categories. They break it down into lots of different subheadings, so because there's different layers of costs. For example, for diagnostic, it is pathology, pharmacy, mortuary. They're all different costs. So engineering functions is different to a non-clinical corridor or storage area. So it's not that simple. All of the square meterage under these headings is available and has been made available to the scrutiny panel. So it is possible, although difficult to work out what is clinical and what is non-clinical, sir, because of the the overlap and the different usages of many of those different categories.
So is the answer for clarification, Minister, that you're not able to provide these figures at this time?
So the I cannot provide a figure of what is clinical and what is non-clinical. So it's a lot more complex than that. All of the square footage of the square meterage of areas has been provided, and it could technically be worked out, sir. But what I would say is that an updated schedule of accommodations will be provided when we get to the detailed planning application later this year, sir. And I'm sure it would be possible for us to work out a figure of non-clinical and clinical space, sir. And I shall certainly put that to the team.
Comment, Iverson, John?
Thank you, sir. I think the original question referred to the cost of digging into granite. Can the Deputy Chief Minister tell us what percentage of the building will be on granite footings?
No, sir, I can't. And groundworks are ongoing, sir. Of course, the cost, I mean, the chances, sir, of digging into granite increase with the amount of excavation. And the recent designs, sir, have reduced basement areas to reduce the amount of excavation required and reduce the chance of digging into granite or other material, which is more costly, sir. But we can't give those exact figures because the groundworks are still continuing, but it's not anticipated to be a figure there, so that is unexpected or cause problems or additional costs to the scheme.
Supplementary comment up?
Yes, please, sir. Would the Deputy Chief Minister agree with me that it's unfortunate that the panel were given that figure, just as it was unfortunate yesterday to be told 40% of Islanders have private health, yet the week before the Health Minister wrote 25% had private health?
No, sir, I disagree. I disagree with both of those comments, sir. The figures for the number of islanders having public health were taken from a social survey, sir, in 2018, and we still believe those to be reasonably accurate, sir. That social survey stated that 87% of people working in the financial services sector had private health, sir, and we still believe those figures to be accurate. In relation to the previous questions, I started, so I think the question was taking the comments of Professor Hander at a scrutiny hearing in response to questions where he used these figures as examples, sir. They weren't based on anything, they were examples to demonstrate that different levels of the building come with different costs.
Thank you very much, Mr. Well. We have Deputy St Martin, then final supplementary Deputy Gardner. Deputy St Martin.
Thank you, sir. So given that the Minister obviously saw the list of all questions before today's sitting, can he explain to us why he's not in a position not to give better answers to the question?
Could the Deputy elucidate that, please, or perhaps be a bit more specific, because I feel I've given a detailed explanation, sir, as to why it is not possible to simply give the square meterage of clinical and non-clinical space at this stage of the design. So perhaps he could be more specific, please.
Yes, sir, I'm happy to be more specific.
Well, I think this is a supplemental question because that is an answer from the Minister. So this is your supplemental, Deputy of St Martin.
Okay, thank you, sir. So one of the three items asked for in the question is the square meterage of the that might be dug into granite. So can the Assistant Chief Minister tell us approximately what the square meterage of the current hospital proposed development is?
The current approximate square meterage construction figure for the whole hospital is in the region of 68,000 square meters, sir. That is going to change, sir, as the final designs are approved for the detailed planning application. So, and at this stage, we expect the final square meterage to be in the region of 65,000 square meters, sir. And these figures are widely available. And if members, which I'm sure they have, and I'm sure the Deputy of Martin has done plenty of reading of the report, so the figures are all there in black and white. But I do stress, sir, we are on stage 3 of a 7-stage REBA 2 process to complete the project. And all of these figures will continue to change until such time as the detailed planning application is presented, sir. And I will undertake to keep members informed every step of the way, sir.
Final supplementary, Deputy Gardner.
Thank you, sir. And I do agree with the Deputy Chief Minister that the progress and figures will be changing. My last question will state two figures, and I would be grateful if the Deputy Chief Minister can explain the difference. On the 27th of August, the Assistant Chief Minister stated in his response to the scrutiny panel at Appendix 1 that 1 square meter will cost approximately £4,497, including preliminaries, costs, and risks. The beginning of September, at the public hearing, Assistant Treasury Minister stated that the 1 square meter will cost 6,200. What the difference? What's happened between 27th of August and September, and if 6,200 including all costs?
Able to answer that, Assistant Chief Minister?
I'm sorry, sir. Was she asking the different? Could you just? Sorry, I'm sorry. I'm not really understanding what the question is. I believe. Could you just repeat that, please, sir? Sorry.
Perhaps you were comparing two figures given at different meetings or in different circumstances. So could you, and asking the Minister, I think, to explain the distinction or difference between them, could you repeat the two figures, Deputy?
Sure. 27th of August, Appendix 1, letter to the scrutiny panel, 1 square meter cost £4,497, including preliminaries, costs and risks. I think it was 7th of September, Assistant Treasury Minister stated 6,200 per square meter. What's the difference happened within this time, and what 6,200 included as an extra?
Okay, sir. Thank you, sir. I would have to review my letter to get the context of those figures that I put in the letter. It would appear, sir, that the Assistant Treasury Minister and I were referring to different aspects of the scheme, but I will clarify that. And what we can be sure of, sir, is we will know the exact square meter costs of the project, as we have done all the way through. And again, it's an evolving and moving figure, sir. But what we do know is that when we do have the final square meterage figure, when the final detailed planning application is ready, the costs will be within the industry, accepted industry figures and brackets, sir. Thank you.
Well, we come to question 6. The Deputy Doublé will ask the Minister for Health and Social Services. Deputy.
Thank you, sir. What is the medical rationale behind the ongoing restrictions on singing in schools? And what assessment has been made of any negative impact of these restrictions on children? And when does the Minister expect these restrictions to be lifted, please?
Minister.
So, public health guidance on music for children and young people no longer recommends a cap on the number of children participating in singing activities. The current guidance advises to take into consideration general COVID-safe behaviours, such as physical distancing, hygiene, cleaning and ventilation, to ensure risks are kept to a minimum, while allowing the benefits of this important aspect of learning and education to continue. There is well-documented evidence that singing is a risk factor in the dispersal of both respiratory droplets and aerosols, which can put both the singers and audience at risk of COVID. In comparison to older adults, school-aged children are an under-vaccinated cohort, and there has been ongoing COVID-19 transmission amongst these age groups for some time. Despite often having a milder form of the disease, there is evidence of long COVID in children, and we do not yet know of any longer-term effects childhood COVID could have in later life. For children who do catch COVID, it can also be negative. It can also negatively impact their education, mental health, and overall well-being. The rationale to have protective measures in place while singing is based on broader public health and well-being rather than just the medical health of the individual. The Children's and Education Minister has made a commitment to keep all these protective measures under review, recognising the balance between reducing the risk of COVID transmission and supporting children and young people's learning. I understand that the Minister is giving active consideration to school performances, including singing, in order to ensure these activities can take place safely. Thank you, sir.
Yes, a supplemental, Deputy.
Thank you, sir. I thank the Minister for his answer. And I want to know about the research that this advice is being based on, because the current and most up-to-date research states that there is no increased risk from singing at the same volume as talking, and indeed in terms of wind instruments and brass instruments, this is actually safer than talking and the same risk level as breathing. So it seems to me that the advice is out of date. Would the Health Minister commit to reviewing the advice, the medical advice that's being given to the Education Department in this area, to make sure that it is up to date, and also to make sure that it's taking into account and fully weighing up the benefits of singing in a group, which include feeling of togetherness, regulating heart rate, reducing stress levels and depression, and feeling of social well-being, to make sure that this is fully weighed up against any potential negative impacts.
Yes, sir, I give the commitment the Deputy seeks, because I know that our public health teams are reviewing research as it comes through. So I invite the Deputy to share that research with our team. But I would remind her, sir, that we've been here before, that there is conflicting research. I refer the Deputy to a written question of some time ago in which the research used by the team was listed with links to very well researched papers. So all that is out there. It's not necessarily all one way. But we, I suppose, take a protective view until the question is absolutely certain. But we'll certainly work with the Deputy to understand the latest research. Thank you, sir.
Deputy Gardner.
Thank you, sir. If I would like to, Minister Devas, if I'm correct, there is a 15 minutes limit for the assemblies. Where this limit, if the 15 minutes limit exists, where the limit comes from, on which medical advice it's based?
So I have the public health guidance on music in front of me. I don't see any specific limits to 15 minutes. But this may be something that schools have introduced of their own volition. There is reference to sort of ensuring that there's time for cleaning, and there are spaces left between the use of rooms where there has been singing. But I haven't read a specific reference to 15 minutes.
You have a supplemental, Deputy?
Supplementary. From what I am aware, there are schools who are not doing assemblies because the time is too short from whatever reason. Would the minister's team work with the education team to make sure that assemblies, which are very important in children's development and children's socialization, will be able to take place within the guidelines that exist now?
Sir, yes. Both I and the Children's and Education Minister wish schooling to be returned to as near normal as possible, whilst being kept as safe as we can make it. So we will certainly speak. I will ensure that our team, I know they're in contact with schools and have worked very well together. I'll take up that point and ensure that if schools want to have assemblies but have felt unable to, that we do what we can to assist that to happen. Thank you, sir.
Deputy Tadier, then final supplementary, Deputy Dublet.
Thank you, sir. I'm trying to understand from the Minister's answer just what has changed since these questions have been asked in the past. As far as I understand, and the Minister can clarify, most children have not been vaccinated, the vast majority, and the advice previously was that airborne particles from singing would be very dangerous. So can the Minister clarify what has changed in terms of the risk?
Well, the risk won't have changed if the scientific evidence is believed. The incidence of COVID might be different in that there is perhaps not the surges that we've seen in the past because of the effect on vaccination in the larger population. But what we have at the moment, there's no longer any regulation around this. There's no prohibitions. There's guidance that is available for all people who are singing or playing music, whether outside of schools or in. And this is, as you would expect, very much around the usual rules that we follow about ventilation, cleaning, outdoor settings where weather permits, but that's unlikely as we go into the winter, I guess. Staggered start and finish times, consider the size of each facility, good hygiene, use of shared equipment should be avoided, just cleaned and disinfected. So it seems to me very much, how we would want and have got used to keeping places and people safe. Thank you, sir.
Supplemental, Deputy Talia?
I do have a supplementary, sir. My concern is about choice, and that whilst adults who have been vaccinated or have had the choice to be vaccinated might want to partake in choirs, pupils at school don't have that choice. They may not have been offered a vaccine and they may have limited choice about whether to partake. And given the fact that masks are still being worn in communal areas in schools, presumably to limit the transmission of coronavirus for those who have not been vaccinated, what's the logic in encouraging young children in close proximity to sing when he's told us in the past that there is a greater risk of transmission from that? And sorry about the dog, sir.
So, sir, there's no prohibition on children singing in choirs. The risks are recognised, and therefore we need to mitigate against those risks, as we do in all our other activities during COVID. So the guidance says if groups are participating, 1 metre distancing at the very least, ideally 2 metres, should be kept between anyone singing and anyone else present. 3 to 5 metres should be kept between any participants facing opposite others present. Adhering to safe physical distancing will determine the numbers able to safely participate in the indoor settings when groups are not all from the same bubble. Of course, if those singing are within the same bubble, you adjust accordingly because they are carrying out all sorts of other activities together. So that there is a good structure in place to guide this activity safely, I believe, sir. Thank you.
Final supplementary, Deputy Dubé.
Thank you, sir. And the Minister has answered one of my questions in that he has not said that whole school singing is prohibited, whereas there is a policy in place in schools at the moment where that is not allowed. He mentioned taking a protective stance of children, and I wanted just to reflect on the current increase in mental health problems, especially amongst children, and the increased importance of community singing in terms of community building and well-being, especially at this time coming up to Christmas, and organising carol concerts and whole school events. Will the Minister ensure his department considers and communicates the health and the well-being benefits of group singing and these events to the Education Department alongside any research that's discussing the negative impacts, please?
Yes, sir, and I confirm we do. And as I said in my answer to the question initially, we do recognise the therapeutic effects of singing together and the community effects that creates to learning and education. So it is a question of balancing the risks, and I hope that as we continue to learn to live with COVID and manage the pandemic, the situation will ease and children will be able to sing together in a easier, perhaps less restrictive way. And we will continue to balance those risks. Thank you, sir.
Well, we come to question 7 that Senator Mezek will ask of the Attorney General. Senator.
Thank you, sir. What provisions, if any, exist in Jersey law to protect residential tenants from being evicted by their landlord when the landlord wishes to sell the property?
Mr. Attorney.
Sir, yes, the residential tenancy Jersey law of 2011 contains 4 sets of provisions which offer protection to residential tenants in the circumstances of the question. The first, sir, is where there's a periodic or recurrent tenancy, or where there's no specified term. The landlord would need to give notice to quit, which should contain prescribed particulars in accordance with Article 6 of the law, and a minimum notice period of 3 months. Secondly, if the tenant does not vacate the property where the tenancy has already ended, a landlord would need to obtain an order for eviction from the court to allow the eviction to take place. Third, sir, Article 14 of the 2011 law allows the tenant or the court of its own motion to stay the eviction or seek a stay of the eviction, either with or without conditions. And Article 15 sets out prescribed matters which the court must consider, and those which the court may consider when considering an application for a stay. And they include a wide range of circumstances, including matters such as the balance of hardship as between landlord and tenant, whether other accommodation is available to the tenant, and so on. Lastly, sir, Article 10 of the law provides that it's a criminal offence for a landlord without lawful reason to prevent a tenant from occupying a property which is subject to a residential tenancy agreement or otherwise interfere with the tenant's enjoyment of the property. And so I would take that to apply in circumstances where perhaps the matter is that the landlord is taking matters into their own hand and seeking to prevent the tenant from enjoying quiet enjoyment of the property.
Supplemental, Senator?
Yes, sir. Could the Attorney General therefore confirm that where a tenancy has a fixed end, which does not coincide with the time at which the landlord wishes to sell their property, that they are unable to require the tenant to leave that property? And would he further confirm that when the ownership of the property changes hands, whether or not the new landlord is bound by law to honour the existing tenancy and see it through to its end?
Yes, sir. The law distinguishes between 2 different types of tenancy agreements, and the Senators referred, I think, to a fixed term tenancy of, say, 1 or 2 years. And in those circumstances, the landlord, well, they could do a number of things, but basically they should wait until that fixed tenancy has expired. Alternatively, they could sell the property to a purchaser, but subject to the existing tenancy. I suppose thirdly, sir, they could try and negotiate with the tenant and see if they could provide alternative accommodation of an equivalent character, possibly even try and buy out the tenant, I suppose, in those circumstances. But the basic provision is that there is the tenant has a legal interest in the property, and the landlord would need to respect that.
Deputy Ward.
Thanks, sir. Again, sorry, I was struggling to hear some of the answer. Can I just confirm, and if it has been, it may well have been answered just in a different way because of these technical questions, sir. Does a landlord who buys a property with a home, with somebody living in it, buy the interest, if you like, in that tenant living in it at the same time, and therefore is legally bound by its specific interest? Is that what the Attorney General is saying? I think he may well have answered that, so apologies if he has.
Yes, sir. I thought I had answered that. So where the original supplementary question was where there was a fixed term tenancy of say 1 or 2 years and the home is, or the property is sold, then the landlord would need to respect that tenancy agreement. And they have a number of options. The basic one would be to sell the property subject to the tenancy, and the terms of the contract of sale would need to reflect that it is subject to that tenancy agreement.
Thank you, sir.
No supplementary then, Deputy Ward. Final supplementary, Senator Mesing.
Not at this point, sir. The Attorney General has been helpful. Thank you.
Thank you very much indeed. We come to question 8. The Deputy Masson will ask the Minister for Infrastructure. Deputy Masson.
Thank you, sir. Will the Minister explain his department's policy with regards to the inclusion of boulevards in urban development areas and how, if this policy exists, it is in line with the State Assembly's acknowledgement of a climate emergency? Thank you, sir.
Minister. Minister? Minister for Infrastructure?
The Minister's muted, sir.
Sorry, sir, I'm having technical problems. Okay, can you hear me now, sir?
Yes, I think the technical problem is solved by pressing unmute, Minister.
Not in my case, sir. There was somebody trying to get in, which I didn't accept.
Very well.
Sorry, I'll start again, sir. Planning considerations for the new urban development areas are a matter for the Minister for Environment, although my officers will provide specialist transport planning advice when required. In terms of my remit and the maintenance of the existing state's main roads, my department seeks to increase urban greening where possible. Within the evidence base for the proposed Bridging Island plan is a St Helier public realm and movement strategy, which considers green infrastructure in the context of climate emergency and will be used to inform the design of future public realm improvement projects. Due to the geometric constraints, there is generally not the space to widen existing roads to create boulevards. Thanks, sir.
Much, well, supplemental, Deputy Masson.
Thank you, sir. I wonder if the Minister is aware that the Planning Committee had a recent application whereby the site had 2 roads, one which was governed by the parish of St Helier, which permitted the boulevards, and one which was governed by his department, and the advice from his department was not to support the boulevards. Given the Minister's answer that he's given to the Assembly in that the department seeks to increase the greenery within the urban area, I wonder if the Minister could explain the current position of the department and its advice which it gave to the Planning Committee. Thank you, sir.
As I say, sir, the department approves of boulevards where appropriate, sir. And I would cite the route to Port Elizabeth as a classic example of where boulevards would work. But it must be appropriate to the area. I would also cite several areas where there have been problems that the trading estate, Rue de Pré, the trees had to be removed because they were interfering with the substructure of the roads and also drainage, etc. So they had to be removed and appropriate trees put in their place. So this has to be taken road by road in its context. I do like green areas, sir, where appropriate.
Deputy Tadier.
So that was an old request on a previous question.
Right, very well. Very well, we come to question 9 that Deputy Southern will ask of the Chief Minister. Deputy Southern.
Thank you, sir. With reference to the rebalancing government finances section of the draft government plan 2022 to 25, will the Chief Minister provide members with a breakdown of how the efficiencies and other rebalancing measures under delivery plans A to D will be implemented without a reduction in the public services previously provided? And will he state how any fees and charges received will be used?
Chief Minister.
Sir, as far as I'm aware, we already have done, and if the Deputy wants to look at, I think it's page 134 of the annex, that gives a huge amount of information of the breakdowns of the proposals under rebalancing. Obviously, if he's got any further queries, I'm sure he'll come back to me, sir. Thank you.
Have a supplementary to that.
I thank the Chief Minister for that information. Would that all ministers were as plainly speaking. But I refer to page 16 of the mid-year review on section 2 rebalancing programme, where it refers to 2 bullet points: increasing the government's revenue through further recovery of existing costs, moving towards full cost recovery of services where appropriate, the extension and increase of existing charges or the introduction of new charges as revenue raising measures. This sounds to me like saving money's sake, and that services will be cut. Can he indicate what are appropriate services that require charging for?
Sir, I can't give a specific example. I do know, sir, and I'm just flicking through to the relevant page, which I can't find at the moment in the annex, which I do know gives some indications. And for example, sir, hang on a moment, I did see the judicial grefts. I think it is increasing charges by, I think it's approximately £50 for a particular service they provide. I shall find that in a sec, sir. That is in the page references that I referred to. But the general framework, so that ministers approved quite some time ago, actually, around costs, is recognising that we do need to look at if the generic principle is that full cost recovery should be done on certain costs. So that might, for example, be where we are competing directly with the private sector. And if we aren't recognising the full cost there, then actually we're subsidising that competition against the private sector, and that would be unfair. I hope that gives a kind of flavour of on the income side, sir. On the overall principles of reduction in services, I would again point out, which I've said on a number of occasions, that in the what was efficiencies and then was rebalancing and continues to be rebalancing proposals, the Deputy will recall that we were originally setting out a target, I think it was for 2020, of 40 million. In that first time, we achieved, again from memory, around 25, and the 15 was carried forward. It was achieved as a one-off, sir, and then pressure. The point was that the departments would have to go away and find that recurring saving again. Now, so where we are now, which is what we said to members, so there's an additional 20 million targets. The overall target is 60. And actually, sir, as we've said, we are aiming to achieve roughly, sir, keeping the numbers as simple as I can, 55 million of that 60 as recurring. And to me, that's really good news. It's demonstrated, sir, that we've achieved that 40 that everybody was quite challenging around. It's taken slightly longer, sir. We've achieved it on a recurring basis, but we haven't cut services, so there haven't been, certainly from the Deputy's party, shall we say, wild outpourings of anger from services that have been cut. But it is therefore, sir, demonstrating that we can make efficiencies, but obviously, sir, that the money that goes through is being reinvested into the areas that identify the government plan. I'll stop there, sir.
Well, Deputy Ward.
Yes, sir. Quite difficult to know what to ask now because I'm not entirely sure I got most of that answer. Can I ask the Chief Minister to commit that any cost recovery will not be targeted towards services for children, such as, for example, the school music service? Charges won't go up to give access to music to children from low-income families, so that it doesn't become a cost recovery service, for example. So, thank you.
Chief Minister.
So I don't have the level of detail in front of me to say, because obviously so it's been done very much down at a departmental level. It'll be a matter for relevant ministers, I'm sure, as and when that comes through, that if there are issues, that the Deputy will take those up with the individual ministers. Sir.
Supplemental, Deputy Ward.
Thank you, sir. Yes. Can I ask the Chief Minister if it was brought to his attention a cost recovery service from a department had been introduced that directly affects children, given that we are putting children first, would the Chief Minister commit to stepping in and stopping such a service charge that may be detrimental to the well-being of children in the long term? Thank you, sir.
I think we've always got to be very careful about absolutes there, sir, because it will always depend on the circumstances. And as I said, depending what the service is, and if it is in direct competition with the private sector, and we were subsidising it against that private sector, then one would always have to consider the circumstances of that we are looking at. So, so the point being, sir, is that it's a framework. It's not going to happen immediately. It's a principle there that's saying, actually, we've not been particularly good at recognising what full costs are in providing certain services, and that's the framework we're operating in. And I know the Deputy has obviously views about whether services should be free or not and where they should lie. Sometimes, not always, sir, I have slightly different views to that.
Final supplementary, Deputy Sutton.
Thank you, sir. Would the Chief Minister agree to circulate a list of services for 2020 and 2021 where fees have been charged for the first time, have been initiated or have increased over that time period?
Sorry, sir. The reason I'm looking slightly puzzled, sir, I'm not entirely sure I quite understand the question, but if it's around what, as I said, sir, I think the Deputy needs to look at the annex, sir, and see if the information that, as I said, is in the annex is sufficient to answer his question, sir. Thank you.
Very well, thank you. That brings us on now to question 10 that Deputy Morell will ask the Minister for Health and Social Services. Deputy.
Thank you, sir. Will the Minister advise whether any staff shortages at the General Hospital have led to full medical records being unavailable to clinicians at any time during the past month? And if so, what action has been or will be taken to rectify this?
Minister.
Yes, sir. There were 5 instances recorded in August of missing clinic files. Those cases are reported on DATIX, which is the HCS Electronic Incident Reporting System. So in part, sir, this was due to the fact that extra clinics were run in August in an effort to clear waiting lists, and that placed additional pressure on the medical records team. But of course, that is a good thing, but creating pressure to another part of the system. But in part also, a review of all administrative functions within HCS and across government led to greater use of bank staff with associated higher staff turnover. During August, this combined with some staff sickness and annual leave being popular in August, this created those instances. The review is now complete, sir, and recruitment of permanent staff is underway. Thank you, sir.
Supplemental, Deputy.
Yes, thank you, sir. How long does the Minister believe it will take for the recruitment of permanent staff to be fully processed?
So we are hoping to have these posts filled by the end of the year. It is library and clinic clerks that we are seeking. Thank you.
Deputy St. Peter.
Thank you, sir. On the subject of medical records, I was wondering if the Minister could give us an update on when the project to have all medical records digitised will come to a fulfilment and be operable.
Minister.
Yes, I can do, sir, and it will largely be repeating a supplemental asked by Deputy Morell to an earlier question, but the paper records are going to be scanned into a dedicated platform, which will be integrated with the new electronic patient record system. The outline business case for this is complete and approved. A full business case needs to be drafted, but this cannot be completed until the procurement exercise is complete. So we will have the procurement completed before the end of this year, and we expect the full business case to be completed in the first quarter of next year, sir. And thereafter, we anticipate it will take 18 months to scan all the historic hospital records, meaning that the scanning and electronic solution will be in place for the opening of the new hospital. I've got a little more detail, sir, but perhaps I'll stop there. Thank you, sir.
Supplementary, Deputy St Peter. Could you turn your microphone on?
Oh, sorry, sir.
Yeah.
Sorry, just. Would you like me to start again, sir?
I think we heard most of that, but you were asking us.
I would just like an observation from the Health Minister as to how much further pressure he can put on to ensure this is delivered, not just in time for the hospital, but for the benefit of all patients who need to know and have the assurance that they have up-to-date, detailed, accurate records in a timely fashion when they are being having any consultation with the various medical staff that need to help them with their particular ailments.
It's absolutely recognised, sir, that this is a priority, not just for the new hospital, where we absolutely can't be carrying up cartloads of paper files to put in a basement, but this is a priority for the team working in the digital services, and money has been voted through the previous government plan, significant amounts of money to make this happen. Government does recognise that it needs to happen and is doing it. Thank you, sir.
Well, Conor Tarbison John.
Thank you, sir. The Minister referred to August, whereas the question refers to the last month. Can the Minister confirm if there were any issues last week with records at the hospital, please?
I think August was given because the question was received in September. I think so. Last week, I don't know, and I haven't heard of any issues, sir.
Any supplemental, Conor Tarbison John?
Yes, so earlier today, the Minister spoke about a business case being brought together for the records. He's just spoken about money being in the government plan. Can he confirm that funds are in place for this project?
That is my understanding, sir. This Assembly has approved that government plan.
Well, final supplementary, Deputy Rowe.
Thank you, sir. And indeed, my request was actually did have September in mind. So would the Minister please be able to confirm that on the 29th of September or thereabouts, clinicians were not able to gain full access to medical records, and medical records were only being processed with the front sheets and, to quote, lined paper inside for the consultant to write. Can the Minister confirm that that did happen towards the end of September, quite possibly the 29th of September? And has he had any complaints from clinicians about the lack of records? And have any patients been put in harm's way as a result of this lack of records?
So I've not been made aware of that. Clearly, the Deputy has heard something about it. So if he wishes to give me details of what he's heard, I will look into it.
Well, we come to question 11. The Deputy Southern will ask for the Minister for Social Security. Deputy Southern.
Thank you, sir. Will the Minister give members a detailed breakdown of how she proposes to alleviate any hardship caused to households by the rise in tariffs proposed by Jersey Gas over the winter period?
Minister.
Thank you, sir. We don't know how many low-income households use gas for their heating, but my officers have been in contact with all the social housing landlords to establish how many social housing properties use gas and actually what they use it for. Across all the portfolios, there are only 158 homes that still have gas. I have asked my office to explore a method to make an appropriate extra payment to any of these households who depend on gas to keep their homes warm. Although I can't give the deputy details of these extra payments, we will make sure that people know how they can expect to receive this extra help so they won't have to worry about using their heating this winter.
Supplemental, Deputy Sub.
Yes, sir. The Minister's response applied only to social housing. What, if any, action can she take on rentals in the private sector? Because they will have to stay as warm and will have similar bills, surely.
Absolutely. As I say, this research started last Friday. As soon as we heard about the gas, we could easily contact the trusts and Andium, etc., and we got the figures. Absolutely, if you're in the private sector, you're a low income, I want to help them as much if they are heating their homes with gas. It's going to take a little bit of time to find out, but it will be the same payment.
Conor St Martin.
Thank you, sir. As the government will be profiting from the rise via the 5% GST on the higher price of gas, is the Minister planning to pass 5% on to the people who need it, such as families who are struggling, members of age concern, etc.?
I haven't thought about that one, sir. It's something I could think about, but I was asked literally how am I going to help households who will struggle to pay their gas bills, but I can look into that for the constable. Thank you.
Supplementary, Constable?
No, thank you.
Very well. Deputy Ward.
Thank you, sir. Can I ask the Minister, in an answer today to written question 385 to the Environment Minister, and it is relevant, sir, which asks about conversion of homes to electricity as part of our commitment to carbon neutrality. It suggested that there is a carbon neutral roadmap and policies will come forward in the carbon neutral roadmap for consultation by Christmas. Can I ask the Minister, will she be involved in that consultation? Does she support the transition from gas to electricity systems for those facing hardship? And would she prioritise those people to give support so that they're not reliant upon what is becoming an increasingly uncertain supply of energy? Thank you, sir.
I do absolutely support. When I think it started with when it was the housing department and then went to Andium, they would, to me, seemed like to be ripping out some very good heating systems and replacing with electric. Actually, it was the right thing to do, and we absolutely know it's the right thing to do. And yeah, if you know, we need much more. As I say, there's only 5% of the whole population that use gas. I think that's domestic. I'm not sure if that's commercial as well. So we are getting there, but gas heating is the thing of the past, or should be. Thank you.
Supplemental?
No, thank you.
Senator Mezet.
Thank you, sir. Does the Minister accept that increased financial payments for those on low incomes to assist with their gas bills, whilst it would provide a neutral effect for those people, it would ultimately be a shift of taxpayers' money into the pockets of UK-based private equity investors? And would she agree, or would she, as the Minister who would have to be responsible for these financial payments, agree that it would be helpful for other ministers to put on pressure onto Jersey Gas or other energy providers to look to a more long-term solution so that we don't simply have to increase financial support for those on low incomes every time that these private equity investors decide to raise the prices?
I absolutely agree with the sentiment of the Senator. I think this is, you know, supposed to be a shortage of this, that, and the other worldwide, and it's ended up making gas that goes into people's home more expensive. But the sentiment I absolutely agree with. I can work with other ministers, you know, but this is going to happen quick and it's going to happen fast. It's going to start coming in the middle of October. I need a solution, sir, that will help people not be scared to put their heating on because it's gas heating, and we will find a way to make sure they get a payment. Thank you.
Supplementary, please, sir. And I welcome that, and providing extra support to those people is absolutely the right thing to do in this circumstance. But I just wonder if the Minister could overtly agree with the point that I've made, which is that ultimately this is money that will end up in the pockets of private equity investors from the UK who have nothing to do with Jersey and no real interest in the sustainability of the energy provision in the island. I ask her to state if she agrees with that point, because I think it helps with the context in the wider debate on moving to carbon neutrality to understand where this money is actually going and who it really benefits.
Well, that's a very big question. The money that I'm putting in will go to the families that need it. And the senator's asking me if I think it's wrong that it will end up in some very rich and powerful companies. And obviously, I don't think that's right either. I'd have to know a bit more to absolutely 100% agree with him. Thank you, sir.
Final supplementary, Deputy Sutton.
I suppose the final supplementary is very often the when question. When will the minister come to this House with her scheme, this Assembly, with her scheme detailed?
Thank you. As I say, it will be a one-off to get through the winter. I probably won't need to come to the Assembly, but I will inform states members, and obviously any help if there's any sort of things I couldn't think of or officers haven't thought of. I'm always willing to talk to people, but it will be soon. The bills are going up. The gas prices go up on the middle of October, so we're not that far away. And if you either get a monthly bill, that'll be at the end of October, or if you're 3 monthly, you'll be getting a bill by December. I want it well in by then, and I'd notify people that the help that they will get by then. I say, we don't want people, if it is really cold, not feeling comfortable, putting their gas heating on. Thank you, sir.
Deputy Taddy indicated a desire to ask a question. That was the final supplementary, I'm afraid.
Right, thank you.
Very well. We come to question 12. The Deputy Ward will ask the Minister for Children and Education.
Thank you, sir. May I ask the Minister, is any increase in the class size currently being experienced, both in respect of primary and secondary schools, and what future increases, if any, are being planned for? Thank you, sir.
Minister.
Thank you, sir. Thank the Deputy for his question. Sir, overall across primary and secondary schools, we are experiencing a slight increase in class sizes for this academic year. Primary school average class sizes have increased from 25.1 to 25.7 pupils since September 2020. So in the same period, secondary school class sizes in year 7 to 9 have increased from 24.0 to 24.6. The average class sizes in year 10 to 11, while lower than years 7 to 9 due to the number of pupils gaining entry to Holia, has also slightly increased from 23.4 to 23.5 pupils per class. Sir, my officers constantly monitor demographic trends and plan ahead to ensure we flex our capacity with more classrooms brought online to avoid excessive class sizes and growth. For example, when we were aware of high birth rates in 2014, plans were implemented to open 14 additional classrooms in 2016 to cope with that increase. So also in September 2020, we opened 3 additional primary classrooms to cope with unexpected demand in government provided school places. These are examples of the planning and flexibility capacity we have in place to ensure class sizes remain in accordance with our policies. So due to the lower than average birth rates in recent years, I'm not currently planning for future increases in class sizes.
Much. Supplementary.
Thank you, sir. There was I would like to know, first of all, whether those figures were across the entire school population, including states assisted schools, or whether they were the entirely public schools, but we don't have a mechanism for doing that. And then to add to that, sir, I would like to ask whether specific circumstances, for example, in secondary schools, where teachers may have to be allocated, for example, to provide support for JTTP students, and therefore their class is allocated elsewhere, which puts temporary increases in class sizes, whether the Minister is aware of those and whether he has a mechanism for highlighting such circumstance so that classes don't go way beyond the average in secondary you mentioned of 23.5. Thank you, sir. Sir, I'm not aware of the what the deputy has said about JTT. We do have policies around class sizes, sir, to make sure that we are not having large increase in class sizes, which will reduce educational outcomes for children. And we are under those policies in most instances. There are some occasions with special educational needs schools or areas for certain catchment areas where we go slightly above, but we never exceed our policy.
Deputy Tadier.
Thank you, sir. Is the Minister able to provide us with a comparison between average class sizes in non-fee paying schools and in the fee paying schools?
No, sir, I'm not.
Supplemental, Deputy Tadier?
Yeah, just to ask if he could go back and let us know if there is what that comparison is and circulate it. Would he be able to do that, please?
So I can go back for two things. I can go and find out what the policy is in the fee paying and non-fee paying schools, and then come back with some figures on that, which I think will be helpful because their policies could be different to our policies within public schools.
So sorry, can I just get clarification? I was asking for the figures. I don't want the policy. I just want to know what the figures are in those schools for average class sizes. Certainly the ones that are state schools, but fee paying.
Is that information that can be provided, Ms?
Sir, of course it can. I was trying to be extra helpful.
Deputy Gardner.
Thank you, sir. And would Minister have figures if there is a difference between town schools and country schools?
Yes, sir. I could put a breakdown together for classroom sizes in town and non-town schools and get them to members.
You have a supplementary there?
Please. Would the Minister give an update? Where is the review into primary education, which was ongoing?
Sorry, sir.
Sorry. Minister mentioned demographics and the capacity, and it was ongoing review into the primary schools, specifically in urban areas, the catchment area, demographics, what's the needs, where is the reviews now?
So I believe the Deputy is talking about the review into schools within town area that we are doing, and though I think it falls outside the question, I will organise for an update to be given to members.
Very much. Senator Balwa.
Yes, thank you, sir. Can the Minister advise what his policy is on classroom sizes and whether that is based on actual numbers or average?
Thank you, sir, and thank the Senator for a question. The policy hasn't changed since the Senator's time as Education Minister. The non-fee paying primary schools, we aim for class size averages not to exceed 26 pupils. In secondary schools, the forms are set at 25 pupils. Both sectors do have policies on when and how class sizes can go above the respective figure. For example, in primary school, classes can go up to 28 places for pupils who live in the catchment area and 29 or 30 pupils via a formal appeal. In secondary schools, 26 places can be offered for a pupil living in the catchment area. So.
Supplemental, Senator?
Yes, thank you, sir. Could the Minister advise whether he has the number of class sizes in actual numbers that are above 26, and if he doesn't have that to hand at the present time, whether he would share that with us as states members?
Sir, in secondary school classes that are above 25, the majority of them are actually Lekenove School, which has seen an increase in demand due to its new school status. The primary schools which have class sizes over 28, so they are, there's one class in Devon, 2 in St Lawrence, 1 in Springfield, 2 in St Martin's, 1 in Platte-Douai, 1 in Samarays, 2 in Lemoy and 3 in Montnicolsa.
Very well. Senator Mezek.
Thank you, sir. And it follows on from Senator Valwar's question. I wondered if the Minister could tell us what he is aware is the maximum class size in a school in Jersey.
So the maximum class size is 30.
And could he indicate where that is? And is that just one example in the island, or are there multiple that are at 30?
I have not got that information in front of me right now, sir, but I can disseminate it when I disseminate the rest of the information to members.
Well, final supplementary, Deputy Ward.
Thank you, sir. May I ask the Minister, how significant does he believe class size is in the delivery of education? And could he give an example of what he sees should be the maximum number in a class, for example, in a Year 2 class, and for example, in a GCSE science class in Year 10? Thank you, sir.
Sir, I'm led by my my department on advice on what a class size is. I believe that it gets reviewed constantly, sir. So I believe that we've got the class sizes right. To go above and have too many children reduces, as I said earlier, sir, the educational outcomes for all children within that classroom, which is why it's important to make sure that class sizes are appropriate so all children get a fair and equal education and get equal time with the teacher for the level of education they require.
Well, we come now to question 13 that Senator Mezek will ask of the Chief Minister. Senator.
Thank you, sir. What plans, if any, does the Chief Minister have to initiate a public inquiry into the government's response to the COVID pandemic in order that an independent assessment is undertaken and recommendations produced on how Jersey's government should prepare itself for any future crises?
Chief Minister.
Yes, sir. Can I refer the Senator to a response, and it's identified earlier in the order paper, that I gave to the Commandant of St Brelard, sir, who's asked a very, very similar question in written question 366, 2021.
So effectively, you're referring the Senator to that answer as providing the answer to this question.
I believe so, sir, yes.
Also, rather than me ask a supplementary, could he refer himself to it and outline what it is for the benefit of people listening?
Yes, sir, I've got no problem with that, but I would have thought the Senator would have been aware of the written question, given us an interest in the subject. Sir, the response, sir, which is obviously available online, was circulated to members previously or through the normal links. The Chief Minister, the question, sir, was, sorry, I'll give the response. The Chief Minister, Minister of Health and Social Services, are committed to regular and transparent States members' briefings on COVID-19 matters. States members' briefings are held on a regular basis and encompass both the decisions reached and the supporting evidence for those decisions. In addition, a range of scrutiny panels are briefed regularly, but also carry out research on key topics, which encompass public hearings and public reports. There's a bit more, sir, but bear in mind this is a written question, it's not designed for a 90-second response. Provided the island remains in a good position and comes through the winter period, we would of course arrange a debrief for States members probably in March, April. However, at this time, the Government of Jersey continues to treat COVID-19 as a pandemic emergency. It is therefore important, especially in a community of our limited size, that scarce resources of the Government are devoted largely to the ongoing threat posed by COVID-19, which is considerable. I think I'll probably pause there because of flavour.
Well, that was quite difficult to follow, Chief Minister. I appreciate you were reading it quickly. Do you have a supplementary arising out of that, Senator?
Yes, sir. I'm glad I didn't refer myself to that question initially because it was complete gibberish. Sir, I would like to know from the Chief Minister whether he believes that a public inquiry exercise of some sort, as is being done in other jurisdictions and in other places in the British Isles, to find an independent and objective analysis of the government's response to the COVID pandemic so that they can produce recommendations and know what we can do in future. It's not a scrutiny review. It's not some sort of politically partisan attack. It's an objective public inquiry, as other jurisdictions are doing. Does the Chief Minister believe that that process would be worthwhile for the island of Jersey so that we make sure that we're well prepared in the future? And is that something he would be prepared to support?
So I do take issue with the complete gibberish. I'd actually said, sir, that I rather felt that in order to avoid duplication, the Senator could have looked at the response that we'd given to the Conotop of St Brelade's, who I think rightly asked the question in written format, and therefore gives a bit of detail to that, sir. The problems with all these calls for public inquiries at the present time is that we're still in a pandemic. And therefore, sir, the point I was making, which is the bit I did read out, is that we do have scarce resource here, sir. We do not have the capacity to both run response against, if you like, against the pandemic and review that response at the same time. So if that means, sir, that at some future date there should be a public inquiry, then so I think that's a matter for the point of that time. I would also make the point that I absolutely agree that there will be lessons to be learned, sir, absolutely going forward. And indeed, sir, as we have evolved our response to the pandemic over the last year, sir, we have adapted our response. And indeed, even within the hospital, sir, as in the new hospital debate, the new hospital, which also we're debating later, there have been changes to take account of our experiences as a result of COVID. But do not underestimate the cost of running that public inquiry, particularly at what point in time it should be. Because if one's going to assess the economic impact, the overall health impact, for example, what's been impacted, delayed of cancer operations because of COVID, then that is going to be quite a long-term project, sir. But I do make the point that talk about that now would have serious issues for our capacity to continue to deal with the pandemic in the way that we have been, sir.
Deputy Ward.
Thank you, sir. Would the Chief Minister not agree that some form of inquiry, short, sharp inquiry, is necessary? Particularly, for example, that later in this sitting, we are going to be asked to extend in P83 emergency powers, but we have no idea and no independent view of how successful they have been so far. Thank you, sir.
Chief Minister.
So I would argue that the measure of success has been that I would still suggest that the island is in about as good a place as it possibly could be, and that has been part of the and the measures that the deputies referred to has been part of that armoury to allow us to combat the pandemic. What I was saying, sir, is that one has to be exceptionally cautious before one commits to a public inquiry. So for the sake of argument, given the potentially very wide range of an inquiry that might take place, I would rather assume, sir, that legal representation might be required from any witnesses appearing in front of us, particularly if they were not politicians, for example, and everything that goes with that. And on that basis, sir, I would point out that that cost would be quite significant. We are not talking a few £100,000, and we are not talking quick and dirty. So if you're going to do a public inquiry, you do it well. You have to pick your time as to when to do it, and that, I think, sir, is a matter for another day. Let's get out of the pandemic, sir, first. Make sure we're clear of it before we put further demands on what has been a very, very good team, but they are limited in numbers, sir.
Supplemental, Deputy?
No, sir. Perhaps I could suggest to the Minister, though, that if he's suggesting that written questions are going to answer oral questions, they can be emailed to members because they are not accessible as they used to be. Thank you, sir.
Deputy Gardner?
Thank you, sir. I would like to ask if Chief Minister can advise if he looked into Scotland and which way Scotland are moving on, and Northern Ireland and other Commonwealth jurisdictions that are lodging public inquiry. And what's the most important, that it is independent. It's not scrutiny, it's not political, and it's a health response. And the importance of this related to the health response and the proven to the future possible pandemics coming to our way and our readiness to this.
Sir, I really do apologise, and I think I now understand why Centre Farnham was having a problem. From my angle, the deputy's breaking up quite a lot. I really couldn't hear the question. Could you possibly repeat it?
Could you repeat the question?
Yes. Would the Chief Minister advise if he looked at Scotland, Northern Ireland, England, other Commonwealth jurisdictions that are about to launch public inquiry, and and would Chief Minister advise if he has seen the difference between independent public inquiry and the scrutiny review, as it would be health response and our readiness to the future pandemics coming?
I absolutely recognise the difference in scope between a public inquiry, which is covered under law and has quite wide-ranging legal powers, and obviously a scrutiny review, sir. The point I'm making, there's 2 points I'm making, is number one, and I'm plucking a figure out of the air, sir. I have no idea if this is remotely accurate, but you know, we are potentially talking about spending £5 million, shall we say. It will be that sort of number. It will not be £500,000. And secondly, sir, the fundamental point at this stage is around not actually putting too much pressure, in my view, on the team that has worked so to such a level and to such an extent for the last 12 and 18 months. They can continue to handle the response to the pandemic, but to actually then, whilst we're doing that response to the pandemic, to actually be talking about doing a public inquiry, sir, is a huge extra commitment and would, sir, put a significant strain, I think, on the response to the pandemic, sir. So I think to an extent, talks about public inquiries, certainly this side of Christmas, for example, to me would be premature. Just as an aside, sir, I know Deputy Ward made some remark about written questions. That's very much a matter for the PPC and the GREF, sir. Thank you.
Well, very much. Supplemental question, Deputy Gardner.
No, thank you, sir.
Final supplementary, Senator Massey.
Thank you, sir. And the Chief Minister's answer is full of contradictions. If it is the case that the government has done such a fantastic job at this so far, then you would expect that there would now be more resources free to dedicate to engaging with some sort of inquiry in a way that, of course, would have been impossible in March and April last year. And the fact that the pandemic is over is, of course, a very good reason for having an inquiry to make sure that we exit it appropriately. So what is it about our situation here in Jersey that is so different to those that Deputy Gardner referenced, that are looking to hold public inquiries sooner rather than later, in recognising that there is still more to do before the end of the pandemic and an independent and objective assessment can be helpful there? Why does he think that Jersey would not benefit from that sort of insight at this point? And would he, if he's not prepared to commit to that, would he be prepared to commit to holding an official public inquiry at the end of the pandemic?
Chief Minister.
Sir, I think I'm afraid I'm going to push back on the Senator. He said there were a lot of contradictions. He has just stated that the pandemic is over. Unless he's got access to information that I don't, I'm not aware that the World Health Organization have declared the pandemic to be finished. And then he said, sir, that the pandemic isn't over. So which is it? And I think actually his question is indicating a fundamental lack of understanding as to how we have been dealing with the pandemic and how much, sir, how much resource has been applied within the existing organisation to handle the pandemic and handle our response to it. And the point I've said all the way through is not about not having a public inquiry. It's about saying, be very careful, or just be very clear what one is asking for, and what the timing is, and what the cost is likely to be. We do so I won't go down the responses that I've already referred to, that we do learning as we're going through. An independent view, I've got absolutely no problem with, sir, but be aware, firstly, cost, and secondly, capacity, whilst we are still in a pandemic, and to suggest that we are not still in a pandemic is actually dangerous, sir.
Well, I think the question was twofold. Is one, why wouldn't you wish that that investigation? But if so, would you think now that a smaller inquiry into those things that can help us going forward? And I think you answered the second question from your perspective, Chief Minister, but I'm not sure you answered the first, I mean, but I'm not sure you answered the second.
The second point, sir, was around, I think still relates to capacity, sir, is making the point that oddly enough, the UK has a population of 60 million people and a civil service to match that size of service. Although, as I said, we have a good civil service, but the pandemic has put capacity issues on normal activity. We've said that we've lost probably we've lost months in a whole range of areas, and the deputy at the centre himself has challenged us on things like housing responses, sir. Well, if he wishes further delays to take place on those type of responses and that policy development, then yes, let's go for a full independent public inquiry, and we start it before Christmas. Frankly, sir, I would not be supporting that because it would put significant strain on the capacity within the organisation. Now, when we come out of that pandemic, whenever that is a different story, sir, and I think that will be a matter for members to consider at that time, sir. But let's get through this winter first. Let's make sure we are clear of the pandemic and that our responses continue to remain robust, sir. That's my focus.
Very much, Chief Minister. Very well. We come to question 14. The Deputy Gardener will ask the Minister for Health and Social Services. Deputy Gardener.
Thank you, sir. Will the Minister advise what consideration, if any, has been given to a move towards treating COVID as endemic as opposed to pandemic in Jersey? And if so, will he explain how this will be determined?
Minister.
Thank you, sir, and I thank the Deputy for this interesting question. A pandemic is an outbreak of a disease affecting many populations over a wide geographical area. At present, of course, the COVID-19 pandemic has a vast global reach. Endemic refers to the normal circulation of a virus in a specified location over time. An endemic virus is relatively constant in a population with largely predictable patterns. For example, influenza is an endemic virus which is monitored globally for its epidemic and pandemic potential. Once we see a stable level of COVID transmission, indicating a new baseline of COVID, we might say the pandemic has ended and the virus is endemic. This will likely include minor seasonal trends, as we usually see with flu. But we are not yet in a position to treat COVID-19 as endemic in Jersey. We have not reached that stage of constancy and predictability. And furthermore, it would be unwise to treat COVID-19 as endemic in Jersey while there is ongoing epidemic or pandemic activity within neighbouring jurisdictions and common travel destinations. Our connectivity makes us vulnerable to further outbreaks. Thank you, sir.
Supplementary question?
Sure. And I'm grateful for the Minister because it's exactly the explanations that I personally seen for pandemic and endemic. And follow these, countries will not enter an endemic phase at the same time because of variable host, environment, virus factor, including vaccination rate. As our vaccination rate is higher than anywhere else, has the Minister considered what number of cases of COVID is acceptable as a level of endemic stability for Jersey? And if so, what number it would be? Is it hospital or community?
Thinking has not developed to that extent, sir, and I would be very cautious about fixing numbers, especially at this stage where we're certainly not in a position to start saying the pandemic is over, because the issue perhaps will not be the number of infections which might be capable of being treated within the community, but issues of concern might be the numbers being hospitalized, or even, unfortunately, any numbers dying. So I think this work will be carried out in due course. And as the Deputy says, it may be that around the world, different countries will think they are in the endemic stage whilst others are in pandemic stage. But I think we really have to link ourselves with the UK and the continent and see what is going on there. We can't exist as an island and pretend that we can manage entirely our own activity in this area. Thank you, sir.
Deputy Ward.
Thank you, sir. Can I ask the Minister, can he perhaps identify some of the features that would mean we're moving towards viewing as an endemic, if you can't get numbers? So, for example, the removal of certain mitigations, the removal of testing at borders, the removal of any isolation requirements. Are they the sort of features we would see as we move towards treating this as an endemic disease rather than an epidemic? Thank you, sir.
The examples the Deputy gave may well be the case. Testing at borders for an infectious disease is an extraordinary step and one that we don't take lightly. So if we were in a position to remove that requirement, that might be a sign we are moving towards an endemic situation. But I think also when we have delivered a vaccination program and been able to vaccinate all the eligible cohorts to the extent that is advised, then we will know that through vaccination we have delivered that to all those persons eligible, and we know that vaccination provides significant protection, though not complete. That is another step I think we could look to. Thank you, sir.
Supplementary?
Yes.
Thanks, sir. Can I ask the Minister, is it not important that a clear message is given so that people understand precisely how his government is viewing where we are with COVID? So, for example, if we are to remove testing at borders, which has been rumoured and proposed by an Assistant Chief Minister, would that not give the message to the population that we are now entering, we are in an endemic phase? It may change people's behaviour. So is the message going to be clear, sir? That's the question.
So yes, there will be a clear message, and we are working at this time on a winter strategy, which will soon be released. And we can expect that we will see different measures being applied from time to time, either relaxed or enhanced, depending on the degree of risk in the island. The fact we may do one thing does not mean that people should think we will suddenly be moving from pandemic to endemic. It is a case of managing over time, and as we move forward, I don't know if I just don't know yet whether we would have a formal declaration of an end of a pandemic or whether we would just move into a different stage. Thank you, sir.
Deputy Higgins.
Could I ask the Minister, before we can even consider going into an endemic phase, we need to be aware of what's happening in the rest of the world and the level of vaccination there, and also the number of variants that are coming out through unvaccinated people. And until the rest of the world is dealt with, we can't very well declare we have an endemic in this island when travel around the world goes on all the time.
Is there a question there, Deputy?
I've just said, yes, the question was, sir, how can we declare that we have an endemic if the rest of the world hasn't sorted out the problem with vaccination or there's other variants? Does the Minister not accept that it would be rather premature to declare an endemic in the island when there's still a pandemic elsewhere in the world?
Minister.
Well, I accept, sir, at this stage today, I would entirely agree with that. What is happening around the world presents risks to the island. And I said in my first answer that we've got to look to neighbouring jurisdictions, and where there's pandemic activity there, we're not in a position to declare ourselves endemic. Thank you, sir.
Supplementary, Deputy Higgins?
No, sir, that's fine.
Thank you. Final supplementary, Deputy Gardner.
Thank you, sir. As the word endemic now regularly mentioned, especially among public health leaders and experts, they're discussing how exactly COVID will be defined as an endemic. Would Minister advise if the STACO public health officials in Jersey started to consider this, or if not, when they will look into this?
My own feeling, sir, is that it's still too early to put a lot of resource into deciding whether and if and when we might declare an end to a pandemic. And as members will know, we have relied very greatly on advice coming through Public Health England, the JVCI, the Medical Officers of Health in the UK, where they have substantial research and resource abilities. So we will continue to draw on those. I know Dr. Muscat draws and is in regular contact with the Medical Officers of Health in those jurisdictions. And I think as they begin to talk about these things, we will also in Jersey, we are part of the conversation, I'm pleased to say, and that time will come. But I don't think we're planning this in any great detail at all very soon. Thank you, sir.
Very much. We now come to question 15. The Deputy Doublé will ask the Minister for Education, Economic Development, Tourism, Sport and Culture. Deputy.
Thank you, sir. What is being done to ensure that all children have convenient and affordable access to a swimming pool and equal access to funded swimming lessons as per the pre-COVID policy?
Thank you, sir. Deputy Raymond will, as Assistant Minister with responsibility for this area, will take the question.
Thank you, Minister.
Thank you, sir, and may I thank the Deputy for the question, which, if I may take the opportunity of prefacing the direct question with that it's great that we have the ability. We seem to be coming out of COVID, as we've heard this morning, and it's essential that we make sure that our youngsters move forward with regards to whatever activity they're doing. And it's great to see that they're out doing other things like running. We've got to encourage our children back into the sports and the bodies that they were doing prior to COVID, which then leads me into the most important activity, which I feel is swimming. I'm totally behind the Deputy, and having done a lot of research over the last couple of weeks with the team, I'm hoping that everything is in place. I can confirm that as all states of Jersey primary schools are now offered free use of the sports division pools to undertake swimming lessons as part of their curriculum learning. The states of Jersey non-fee paying secondary schools are also offered free access to the sports division pools where their timetable allows. Fee-paying schools are offered access to the sports division pools charged at a 50% normal hire rate. Schools are timetabled prior to the end of each academic year, and each school can request access for whatever they require. And for argument's sake, that's PE lessons, learn to swim, GCSE, moderation, scuba, galas, and water polos. But the major thing here is to make sure that as an island, one of the most important activities that all our children should be doing, and dare I say it, across the board, that the earlier you catch the children swimming, the better it is for their mentality and living on an island. And I totally agree that we've got to make sure that we provide these facilities, and hopefully that is what we're doing at the present time. Thank you.
Supplemental,
Thank you, sir. Thank you. The Minister will be aware of two specific issues because I have raised these over email. One of the issues is the Aquasplash, due to staff shortages, is closing not the adult pool but the family pool, apart from I think 2 or 3 days a week. So I would like to know what is being done to support the Aquasplash in providing access, which of course will be particularly convenient for families who live in town, possibly lower income families who don't have a car or access to the ability to utilise public transport to get to Lekena Bay. So I'd like to know what the government are doing to address that. But also another issue that has been raised is the reception funded swimming lessons, which pre-COVID every child had a course of 10 swimming lessons in their reception year, and I've been informed that not all children are currently able to access those. So could the Minister address those two specific issues, please?
Thank you. Can I take the second question first? As far as I'm aware, I thought everything was in place. It has just slightly concerned me with what the Deputy has just said, sir, and I will certainly look into that. But I'm given to believe that having had discussions with education, that was in place. But if I may, I will come back to the Assembly and let the Deputy know. With regards to the first question, yes, we are having difficulties. It would be silly not for me to say so. The biggest issue is they're coming back with regards to the ability to get staffing. And as you know, with swimming, we've got to make sure that we have the right people in the pool at the right time. And it's essential they're there purely for risk reasons as well. I, again, am very keen to push this very much forward, bearing in mind the amount of money that, dare I say it, that we put into the swimming pool in Vars Serco. So it is important that we look after, and as the deputy rightly says, if we take the 35,000 odd population that are in and around the pool, it's essential that we try and make sure that that limited availability of the small pool becomes much more greater for people in St Helier to use, and especially because it is very much in walking distance to a lot of people that do need that requirement. Again, it's not a definitive answer, but I can assure both the Assembly and the Deputy that we're moving forward on those discussions, and I'm very much involved with them.
Well,
I'm sorry, sir, the Minister didn't answer the first part of my question about the receptions.
are you able to provide a more elaborate answer than that?
But as far as I'm concerned, I thought what was it, that it's 10 free lessons, isn't it? 10 lessons for reception children. I believe that was still in place, and I was given to believe, but I will check that with education. If the deputy could give me a particular school or where that has happened, I'm more than happy to look into it.
Well, that brings the period for questions with notice to an end. And we now come to questions without notice, the first period for the Minister for International Development and Deputy IEA.
Thank you, sir. Will the Minister advise the Assembly of what Jersey's response to the unfolding humanitarian disaster in Afghanistan has been, and if any assistance has been given to those affected by the Taliban takeover? Thank you, sir.
Thank you, sir. Over the last 40 years, Afghanistan has experienced a succession of conflict, invasion and natural disaster, impacting the potential for education, investment, livelihoods and infrastructure. As a result, Afghanistan is one of the poorest countries in the world. It rates 169 out of 189 on the Humanitarian Development Index. Following the fall of Kabul in August, we have assigned 375,000 to 3 organisations to provide life-saving support to those most in need. 150,000 is going to UNHCR, 125,000 to the British Red Cross, and 100,000 to the NGO Street Child. Jersey's contribution to the UNHCR will assist the organisation in delivering an emergency response that meets the immediate needs of 600,000 newly displaced people. Street Child will use Jersey's funding to help provide emergency support for 15,000 vulnerable children in 2 Afghan provinces, with the highest proportion of displaced persons caused by the ongoing conflict. Notably, Jersey's aid will help to protect and educate around 7,500 girls who are at extreme risk of violence, exploitation and early marriage. And finally, recognised for its neutrality and independence, the Red Cross and Red Crescent movement has a vast network of local volunteers and over 30 years of experience in navigating the complexities of working in Afghanistan. Jersey's support will enable the Red Cross to provide healthcare, food and other life-saving aid in even more remote areas of the country. Next week, I've been invited to discuss the issues further with the head of UNHCR in Geneva.
Much. Supplemental, Deputy IEA.
Thank you, sir. Were there any ongoing projects being funded by her department in Afghanistan? And if so, have they been forced to seek activity? Thank you, sir.
Minister?
Thank you. In a place such as Afghanistan, Jersey Overseas Aid does not engage in sustainable development projects. Instead, we offer humanitarian aid, which we are currently doing to the total of 375,000, which I've just explained. Therefore, there are currently no ongoing projects as such, other than the emergency relief. Over the 11 years up to 2016, Jersey did support the Afghan people by allocating nearly 1.3 million in response to their urgent needs.
Well, Conataba St Martin.
Thank you, sir. Has Jersey Overseas Aid played a part, had any involvement in Jersey's response to the global pandemic?
Yes, indeed. Jersey has donated 1.85 million in 12 donations to tackle COVID in developing countries. Some noteworthy support might include 450,000 to the Red Cross to support essential health care in vulnerable communities, and the delivery of £2 million worth of medicines by international health partners at a cost to Jersey of 185,000. This pandemic, as well as posing a significant risk in itself, has undermined the livelihoods and disrupted essential supply chains, increasing the threat of hunger and resulting in a rise in death from treatable diseases. Thank you, sir.
Supplemental, Conataba.
Thank you. With the aid that the Minister has mentioned, so has Jersey Overseas Aid has supported the COVAX programme? Or has?
We have supported COVAX with a donation of 200,000 to UNICEF and 100,000 to the Red Cross on a similar related effort. However, while COVAX is fairly successful in getting vaccines to developing countries, it is facing many challenges with getting vaccines into people's arms. Take-up is low, and in many cases, the doses go to waste. This is partly because difficulties in the logistics and cold chains, poor public health capacity, and widespread distrust in certain countries. Jersey Overseas Aid looked closely at supporting COVAX directly, but we decided its resources were most effectively spent on support work, which is a vital element to the success of the unprecedented vaccination programme. Therefore, we are helping UNICEF with the logistics and the rollout, and the Red Cross with a vital public information campaign. From a risk and due diligence point of view, we are also restricting our support to agencies whose effectiveness is known to us, rather than opening new relationships, for example, with the World Health Organization or Gavi.
Senator Moore.
Sir, if I may quickly, we're already over halfway through this question session. We've only had questions from 2 people. May I suggest that we don't allow supplementaries, sir?
Well, I'm certainly open to not allowing supplementaries. We've only got 2. We only have a few minutes left. We will finish it this question period at 12:47, and perhaps members would only ask or seek to ask supplementaries if they believe them to be essential, and I'll take a view in a moment or two as to whether that's working. Very well. Senator Moore.
Thank you, sir. Given the skills crisis we are facing in many sectors in this island, where businesses are struggling to operate due to staff shortages, is the Minister considering how the island could assist developing nations where people are struggling to find work due to either a weak economy or conflict?
Minister.
Thank you. I'm not entirely sure what the Senator is getting at. Is she suggesting that we look to other countries to bring people in for work, or we assist them in upskilling.
Well, I'm not sure this can be a question exchange. I mean, without a supplemental, then are you able to clarify your question, Senator?
I think the Minister has shown her understanding of my question as it was intended. Thank you.
Does that conclude your answer, Minister? Yes.
Yes, well, we have, through local charities, some educational programs through various charities and NGOs. Education is not one of our themed focus areas, so we don't have expertise in that area, but I'm still unsure whether what the Senator was getting at, if she's looking to Jersey Overseas Aid for sourcing labour for Jersey.
I'm afraid I have to draw a line at that particular question. Senator Mezek.
Thanks, sir. Can I ask the Minister for a relatively succinct answer on whether or not the Overseas Aid Commission is providing sorry, there's an echo. Okay, I think that stopped. Could the Minister indicate whether the Overseas Aid Commission is providing any support to help alleviate the drastic humanitarian crisis in Yemen?
Yes, indeed. We have provided over 2.5 million in assistance in Yemen. That would, we don't only assist them with direct humanitarian support, but also through our pooled funds with the UN. They are out there on the ground and they can assist in that way. And we have consistently supported them over the last 5 years.
Supplementary, please, sir. That's excellent to hear, and I'm fully supportive of that. Would the Minister acknowledge, though, that the humanitarian crisis in Yemen is drastically exacerbated by the, frankly, morally abhorrent interventions made by the Saudi dictatorship? And would she therefore agree that if there were to be a country with whom we would change our diplomatic relationship with, Saudi Arabia ought to be much higher up on the list than the Faroe Islands?
Jersey Overseas Aid goes out of its way to not enter the political fray, which is exactly why the Commission has been set up as it is, so we can be impartial and independent and give aid where it is due.
There are 5 more individuals indicating a desire to ask questions. There's approximately 5 minutes, allowing for a slight slippage for injury time. I will allow no supplementaries at this point, simply to enable everyone to at least have a chance to ask one question, if that is possible. Deputy Masson.
Thank you, sir. Since the launch of the Island Identity Project earlier this year, could the Minister outline what progress has been made?
Yes, thank you. As the Deputy knows, the project was launched on the 5th of May this year. And since that time, we have been consulting, and the consultation period ends on the 12th of October. And we've been promoting it through various channels and translated the documents into Portuguese, Polish and Romanian. Just succinctly, I'll try and do it succinctly. We have commissioned the writing of materials, which once we have checked it, we intend to put it up on our website, and that can be used in schools, the civil service and newcomers to the island, forums such as that. We've been conducting a number of meetings across government and with ALOs, who we hope will be delivering a lot of the aims in the Island Identity Project. We've engaged with the parishes on a roadshow, making presentations at parish assemblies. We've got a series of essays being written in particular themes, and as I said, We
I'm
have
afraid
had,
that's 90 seconds for the answer, Minister. I shall ask you to bring that to a close if you please.
yes.
Constable Gruville.
Thank you, sir. In the Jersey Overseas Aid annual report, the amount dedicated to Jersey charities increased. Can the Minister explain what this was spent on? And would the Minister agree with me that supporting overseas aid projects through supporting local charities is a win-win situation?
Yes, thank you. Yes, indeed. Our contribution to local charities has gone up by 500% since 2016. In 2020, we were giving £2 million worth to local charities through grants. These charities have range in size, from kitchen tabletop to larger entities such as Durrell and the RJA NHS. I'll give you some examples of that work. Hands Around the World, for example, have got an education project in Rwanda. The Gurkha Welfare Trust is implementing water and sanitation and hygiene in rural parts of Nepal, which has an impact on tens and thousands of individuals in need. And supporting local charities is indeed a win-win, not only because we're supporting them, but because in a lot of cases, like the RJA NHS with our dairy projects and Durrell with our conservation livelihoods, and indeed financial inclusion coming from Jersey, we can draw on Jersey's expertise. So yes, it's a win-win. Thank you.
I'm afraid even with an allowance for injury time, that brings the time available for questions this minister to an end. Someone propose the adjournment. Well, Assembly stands adjourned until 2:15.